How can you understand the causes of neurogenic bladder? Imagine your bladder as a well-coordinated team that relies on nerve signals to know when to hold or releases urine. When these nerves are damaged or not working properly, it can cause neurogenic bladder, a condition that affects how you control your bladder. To understand what causes this, we need to look at the different ways nerves can be affected and disrupt this communication. The most common causes involve issues with the central nervous system, which includes the brain and spinal cord. Conditions like strokes or multiple sclerosis can interrupt nerve signals, making it hard for the brain to tell the bladder when to empty or hold urine. Diseases such as Parkinson's or Alzheimer's can also interfere with nerve control, as can brain or spinal cord tumors or injuries from accidents. Some people are born with nerve-related birth defects like spina bifida, which can affect bladder control from a young age. Encephalitis, which is inflammation of the brain, may also damage nerves involved in bladder function. Nerves outside the brain and spinal cord, called peripheral nerves, can also be damaged and cause neurogenic bladder. For example, long-term diabetes can lead to diabetic neuropathy, damaging nerves that control the bladder. Heavy alcohol use over time can also harm these nerves. Sometimes surgeries in the pelvic area accidentally injure bladder nerves, or herniated discs and spinal stenosis, narrowing of the spinal canal, can put pressure on nerves that control the bladder. Deficiencies in vitamin B12 or infections like syphilis can also damage nerves and lead to bladder problems. In addition, spinal conditions such as degenerative diseases or trauma affecting the lower back can compress nerves that supply the bladder, especially the sacral nerves or the cauda equina, which is a bundle of nerves at the base of the spine. All these factors can interfere with the nerve signals needed for normal bladder function. To figure out what's causing neurogenic bladder, doctors will take a detailed medical history and perform a neurological exam. They might order tests like urodynamic studies, which measure how well the bladder stores and releases urine, and imaging tests such as MRI or CORT scans to look at the spinal cord and nerves. These evaluations help identify whether nerve damage is due to injury, disease, or other conditions. Understanding the cause is important because it guides treatment. Neurogenic bladder can lead to problems like urinary incontinence, retention, frequent infections, or even kidney damage if not managed properly. While it is not directly linked to bladder cancer, ongoing bladder issues can increase the risk of infections and other complications, so regular monitoring is essential. In summary, neurogenic bladder results from nerve damage affecting bladder control, caused by a wide range of neurological conditions, injuries, infections, and systemic health issues. Getting a proper diagnosis from healthcare professionals is key to managing symptoms effectively and protecting your overall urinary and kidney health. Always consult a medical expert for personalized advice and treatment options tailored to your specific situation.